Hi, I'm Dr. Brad Maru. I'm the clinic director here at Spine and Injury Medical Center. And I'm here to talk about an awesome therapy that we have. It's called decompression. Decompression, what is it? What does it do? How does it work? Well, decompression is one of the primary non-surgical, non-drug treatments that we use to help people with low back pain. Let's take a look at this x-ray here. Is a perfect example. Someone who has good disc spacing here. This is, of course, the lower back spine, and then right in here they have a degenerative disc. Now, x-rays don't show us if there is a expansion or bulging here, but based on the patient's symptom and based on this x-ray, we can tell that the disc has been damaged and likely causing a lot of the pain coming from the lower back. So here we're looking at an MRI of the lower back, and here we can see right in here, this is a disc bulging out. This is a normal, natural disc following everything along the line, vertebra, smooth, here bulge, here bulge. So this person's got a lot of damage to the disc here. We can see this evidently. This is where decompression can actually be effective and really help. So now we're going to be looking at what does decompression do? What does it look like? Well, we're going to go ahead and play this little video here for you. And what we're going to do is see what a decompression machine actually does. See, it's going to expand the space of the disc, sucking in, creating a negative pressure in that disc, which causes the disc to suck back in and the nutrients to be pulled into the disc. Most of the time when people have back pain, they have a lot of muscle spasm that restricts the motion of the disc, and that stops the circulation from happening, which makes a bad chronic disc pain worse over time because it continues to damage the disc because there's not enough circulation, which is exactly what decompression resolves. It increases circulation, gets the natural body fluids in there, gets the natural oxygenation in there to actually help the body heal naturally. And that's, again, just one of the many facets that decompression does for helping restore disc and joint integrity over time with this type of conservative care. It's really awesome. So what we're going to be showing you down here is our decompression table. Let's have you take a look over here. You can see we have a couple tables. The decompression table is the #1 non-surgical, non-drug related therapeutic treatment for back pain. Back pain in regards to disc bulges, disc herniation, chronic pain of the lower back, arthritic lower back, and degenerative joint disease of the lower back, sciatica, to name just a few of them. What we're seeing here is the lower half of the body being distracted away from the upper half and strapped in, so it's allowing this pull to happen, and what that's doing is expanding the disc space. That expansion of the disc space is going to allow the water and nutrients to flow into the disc, and then taking pressure also off the nerve at the same time to allow for open nerve communication, nerve flow, and decompressing that area, which is going to relieve the actual pain and the inflammation in there. When this is done in a certain sequence and timing, it actually helps creating a pump for that lower disc, which actually helps the disc increase its overall circulation, which actually helps it heal naturally, without drugs, without surgery. It's amazing. It's really, really awesome. And the people that get this treatment really find it's very effective, and it's actually effective not just short term, but long term. This, performed with other therapies, actually helps create more long-term correction, long-term change.